Hey everyone, thanks for joining. We're going to be doing a 2020 recap for Vaxil. For people that are just hearing about Vaxil for the first time, I know we've only been doing videos for a few weeks. Really, if we could jam the past year into a few minutes here just to get everyone up to date. I'll throw it to you if you want to go over again some of the highlights, where maybe if you want to start from where we started to of course where you guys are now. That would be awesome.
The story of Vaxil is fascinating for me. I joined a couple of years ago. The company had been around a little bit, a couple of years before that. It's a company that is a clinical stage biopharma company, so pretty unique in that sense. Clinical trial was done earlier in multiple myeloma. In terms of catching us up sort of quickly and what's happened in 2020, zooming into there. So we've been progressing our preclinical work in oncology. We haven't made any announcements. It's lab work, right? So we're progressing. We do some computational stuff. We look around at different targets, and hopefully we'll be able to make some announcements next year on progress and things that we've accomplished in that space. In infectious diseases, so the big news this year was our discovery back in February of a candidate vaccine for COVID. We're not one of these companies that sort of just opportunistically woke up and said, oh, COVID, great opportunity, let's go. We're a company with science and solid science in the preclinical space around infectious diseases. And that led us to operate our bioinformatics tools earlier this year and discover these vaccine candidates. So with that, we went to work and started the preclinical testing to see if we could generate an immune response. We did that in the lab first successfully, and then we ran an experiment with our partner at the Tel Aviv Medical Center in animals, where we were successful there as well. So that was really exciting for us this year to be able to progress the vaccine through those stages. And we also launched our USAMRIID study, our collaboration with the U.S. Army Research Group, where we are running what's called a challenge or protection experiment. Pretty excited that we were able to get that going. We signed the contract a little while ago, and we've been in the prep stages, and we're looking forward to the first vaccinations shortly. More to come on that. We hope to have those results pretty soon in the next couple of months. We're looking to see that the animals generate an immune response, but also when they're challenged with COVID, the ones who are vaccinated do better than the ones who are not. So that's our really exciting news on the USAMRIID side. With oncology, we're also looking at various other infectious disease targets, and we'll look forward to having some news about that in 2021 as well. Vaxil is different from a lot of other biotechs in two ways. One, I think I would start with the science. Our signal peptide platform is unique. There are very few, if any, other companies working on this type of approach. It presents quite a few advantages over many of the other ways that people attack various diseases like oncology and infectious diseases. First of all, because of the signal peptide, the part of the protein tends to be in a section where the mutations don't affect it. Our technology would tend to survive. We would expect it to survive through mutations. We also believe that our platform is very safe. We've seen that in our clinical trials, so that's another unique aspect. We don't see side effects other than injection site problems, which pretty much every injection would see. And another key advantage we have in the platform is the scalability. It's very easy to scale up. Once we have the manufacturing process, we scale up in a very simple and inexpensive way, which gives us lots of advantages out in the marketplace. I think the second aspect of what makes us unique is our commercial experience that we have in the company. Obviously, science first, and our goal is to help patients. But understanding how a medicine gets to market and how it actually helps patients is critical. Myself, I've got 35 years in the pharma industry, CEO of Pfizer Israel, CEO of AstraZeneca Israel. I headed up Pfizer's worldwide business development and strategy group. So I have lots of experience understanding how drugs get to market and what it takes. It's not uncommon to see small startup companies have some missteps because they're more focused on the science and not as focused on understanding how the science actually gets to patients. And that's critical. We also have a great board in the sense that our board also has good commercial and business sense. And so we're very much guided by having good, solid science, but especially that science that can be brought to patients.